Thank you for coming. Today is a day laced with sadness. It's the International Overdose Awareness Day and Recovery Month, and I want to emphasize recovery. We're looking at a nation that since 1999 has lost over 1 million people to overdose. We're looking at a county of Suffolk that last year lost more than 390 people, that's one person a day, to overdose. We're looking at so many things that are happening, but let me start off by introducing some of the elected officials here today. We're joined by our district attorney who will speak later, Ray Tierney. Myself, I'm Supervisor Ed Romaine. We have our Brookhaven Town Clerk, Kevin Laval, our Receiver of Taxes, Lou Marcosia, Councilman and Deputy Supervisor Dan Panico, Councilman Jonathan Kornreich, Councilman Michael Loguercio, and Councilwoman Jane Bonner. They are here today, this day, to call attention to the overdose awareness that is permeating our county, our state, and our country. I don't know how to say this, but we've got to stop. We've got to have better treatment facilities. We've got to help out and reach out to those afflicted and those addicted. And we've got to stop the flow of fentanyl into this country. Fentanyl is coming from China into Mexico. And we have what some people would say is an open border policy, which doesn't stop the drugs from coming and spreads throughout the United States. Right now, the weight of a large mosquito may be about 2 milligrams. That same weight in fentanyl is enough to kill a person. Think about that. And yet, if you're peddling fentanyl under the state laws of New York, you get bail. You get cashless bail. You have a revolving door of justice. That has to stop. We've got to stop the fentanyl coming in. We've got to make our children and everyone more aware of the problems that are posed by all types of drugs, many of which are laced with fentanyl. We've got to improve our treatment facilities, and we've got to do more outreach and counseling to ensure that we lose no one else to this. This is why we are gathered here on Town Hall steps to call attention to this national problem that is so prevalent in this community. In 2010, 1.1 person per 100,000 in this county lost their lives to overdose. By 2020, it was over 26 persons. It more than doubled, it almost tripled in those 10 years. This is a crisis that afflicts all of us, because anytime anyone is affected by an overdose, even if they survive, and thank God for that now can, but even if they survive, that family and their friends are so affected. It has a ripple effect that goes well beyond the person themselves. And for those who've lost ones, the pain, the ache, the sorrow, the wish that you could turn back the clock and say to them, please don't do this. Stay with us here. We don't want to lose you. So with that, I'm going to turn it over to our district attorney, who has done a great job and will continue to be on the front line of fighting this, at least from the perspective of stopping all the illegal drugs, and fentanyl in particular, that permeate our county. District Attorney.
Thank you, Ed. It's always dangerous following Ed Romaine because, he basically said everything. So I thank him for that. And I also thank him for his partnership in this fight and everyone standing here, Neil, Manzella, everyone. I'm indebted to be the District Attorney of Suffolk County, first and foremost because of the people of Suffolk County who support me and allow me to do a lot of the things that I do and advocate for a lot of the things that I advocate. I can only do that through the support of the citizens of Suffolk County, so I want to thank them. And of course, I want to thank all of these public officials behind me who we've spoken about this opioid crisis, and we recognize what happens and what is happening. And really what we need is we need to stop talking about it and we need to start doing something about it. And that begins by asking our public officials to stop paying lip service to public safety and start doing something about public safety. As the supervisor said, we know what's happening with this opioid overdose crisis. 399 of our citizens last year alone, and that number is rising as we continue to do autopsies. That means that more than one of our Suffolk County citizens a day dies from an opioid overdose. That is outrageous. We had 30 homicides, but 399 opioid overdoses. If we had 399 homicides, there would be a lot of outrage. But let me tell you, for the families, it doesn't matter. If you lose a loved one, you lose a loved one. It doesn't matter how. The pain is no different. Later on this afternoon, I'm going to meet with another overdose family. We're going to talk about some things that we want to do as far as advocacy, because I'm done talking. I want to turn it over to the victims and their families, because I think they can describe what they're going through a lot better than us. And I'll leave you with this. We talk about the things that I need. We need to make fentanyl a bailable offense per se. Not if you, as Ed said, 2 milligrams is enough to kill you. But yet we could only ask for bail if you possess 8 ounces of fentanyl, which is about enough fentanyl to kill 114,000 people. So that's ridiculous, right? Right off the bat, that's ridiculous. And we talk about xylazine, nitazine, all these other, under New York State law, those are not illegal. It's no different to sell these incredibly dangerous substances in Suffolk County, no different than if they were selling baby aspirin. We can't touch them. We have to beg our federal partners to help us. So that needs to change. We need a death by dealer statute. But I think more than anything else, I think the other thing is, I understand we can't just jail and incarcerate our way out of this. I mean, when you talk about the people who are preying upon the addictions of our citizens and killing them and profiting from that, that's a small percentage of our population. So absolutely, we need to incarcerate those people. But what about everybody else? What about everyone else who's addicted and afflicted by these drugs? They're so much more powerful than the traditional drugs such as heroin and cocaine. What about those people? What are we doing for those people?
What about the people that are struck and killed when these users get into a car and kill my friend's son, a fentanyl user, and we have bail on that? There needs to be tougher terms and limits
the cascading effect is tremendous. But really what I'm left with oftentimes is a zero-sum game. Either we ask for bail when we can ask for bail, and oftentimes we can't ask for bail, or the person gets out. And we've defunded a lot of our prisons. Rikers Island is a mess. Where did all that money go? Did all that money go for treatment, mental health treatment, and substance abuse treatment for our afflicted? It disappeared. It's not going to the people who need it. So these are just some of the things that we need to talk about. And later on, this year, we're going to go to Albany with a lot of our public officials and with our victims' families, and we're going to take our argument to our legislature and our assembly and say, please listen to what's happening. Pay attention to what's happening on the street in Suffolk County, in New York State, and all across the country, and stop talking about it. Do something about it. So again, I am I am just so gratified for Ed and the entire Brookhaven team. I'm gratified for you all, and thank you very much. I have a proclamation for Brookhaven. I also have a proclamation for Ms. Carbonaro. Again, as I said, I'm meeting with families later, and I'm so gratified that there are so many families on Long Island who suffer this tremendous tragedy. And rather than turn inward in their time of grief, they turn outward, and they say and they fight to try to prevent other families and other people from going through what they did. And I'm so impressed by that, and I'm so gratified, and I thank them very much. And although it's not enough, we do have a proclamation for you. So thank you very much.
Thank you. Our next speaker is our Deputy Supervisor and Councilman Dan Panico.
I will just follow up on what our district attorney had to say. The time for talk has to go. It's time for action. People are dying in the streets, and there's not one solution to this. The border is right. Changing our criminal laws is correct, but all of us as a society have a role to play. These are human beings. These are our families. And I'll tell you, nothing makes me more sick than when I see on social media a person who's a human being being videoed on a sidewalk and the comments that ensue, almost as if this person is, the comments are not even befitting a wild animal. These are human beings who need help. And the money, as the district attorney spoke about, where is that money? And the overall shift, even in our state government, where our state government now tries to balance its budget on tax revenue coming from things that lead to addiction. That is what is going on in New York State. As a means to try to balance the books, they've promulgated rules and taxes on marijuana, which is a gateway. Gambling, online gambling, these all also compound and lead to addiction. We need a shift not only in our society, but in our government, because these are human beings of flesh and blood, just like us standing here today. And unfortunate circumstances could happen in anyone's life to lead you potentially to that. And we must never forget that these are human beings. Councilman Loguercio is a member of the Ridge Fire Department, and he tells us all the stories. He drives the ambulance of what he deals with now, not on a rare occasion, but almost on a daily or weekly basis. And when he comes up, I hope he'll share those stories, because those are firsthand stories of human beings in the struggle that we need to help. I thank you all for coming and calling attention to this.
Thank you. You should recognize our next speaker, a long-time newscaster from News 12, recently retired, Drew Scott, who lost a granddaughter, and we'll talk about that and the agony that comes with loss. Drew.
Thank you, Supervisor. Thank you, Mr. District Attorney and Town Council. Addiction and overdose awareness has a face. This is one of the faces. This is Hallie Ray Ulrich. She lived a beautiful life, and I want to express my condolences to all of you who lost a loved one. Overdose awareness is a good thing, and remember that addiction is a disease, and we have to treat the disease. But another thing is that fentanyl, one pill can kill, and curiosity can kill young people as well. Just one pill at a party, out of curiosity, has killed so many of our young people. So please join the crusade and do something about overdose awareness and fentanyl, and fight. Don't give in to the stigma. Don't hide. Let people know what happened to you and your family. Carol Trottier is here. She lost her beautiful son. Thank you for being here as well. Don't give in to the stigma. That's my advice. And again, thank you so much for recognizing overdose awareness in the town of Brookhaven today.
Thank you. Lori Carbonaro from FIST. And tell us what FIST is. Come on up together. Good to see you again. Good to see you. Thank you. Lori, good to see you.
So, short one is Lori. This is Dorothy. My son has been gone almost 10 years, Nicholas. And since then, I've happened to join with many of the people here, awesome people, warriors, to stand up for those that are gone and those that continue to struggle and those that we need to prevent this. The children, the young people, the families need a lot of help. It's not just recovery once you have lost somebody. It's recovery from the minute our kids are gone through addiction. They're not our children anymore. So when we actually, in Families in Support of Treatment, I found this group of people on a bus going to Albany to fight for some bills for insurance reform. And I've actually still have them with me almost all the time, Dorothy being one of them, many people here that are standing with us. And I just ask you, do not isolate, do not stay alone in any level and station of this horrible substance use disorder throughout. There are so many. I say all the time, don't wait to talk to your little children about what's going on, because it's, yes, very fearful to talk to a young child about, not heroin, but about anything dealing with drugs. But maybe it's better to be fearful of that and do it than to have to pick out a casket. So we need to really, really, really work together. I'm so thankful to everybody. Dorothy, hug me.
I love you. Love you too.
And for, this woman's been doing this for 13 years?
13 years.
13 years. Yeah. And there are people that I know, some here, that have been doing it for 20 years and 22 years. As everybody just spoke here eloquently, better than I have, it's got to stop. Not just the addiction, but stop hiding. Come out, get in the sun, talk to your people, your community, and those that think that it's not in their community are sadly mistaken. I didn't think it was going to happen to me. So on that note, please, I'm glad. Yay, we're purple, yay. Yeah. But next year, let's be like island purple for sure, New York purple. Thank you for listening. And here is Dorothy, my friend.
This is my son, Max. Tomorrow will be 13 years that he's gone. Max was my only child. I would like to quote my friend Robert Kent, the former counsel at the White House Office of National Drug Control Policy. Commitment means being there for others, especially when they are struggling without judgment. Honoring the commitment you have made to others, helping because it is the right thing to do, versus adulation, praise. Commitment to changing drug policy means overcoming limits on access to life-saving medicines. The belief that folks are not in recovery if they use medicine to treat addiction. The concept that we must only invest in evidence-based interventions and then doing little to produce the evidence. The belief that we know what is best for others. These are the major obstacles. I know there are folks that are committed to making things better. Margaret Mead was correct when she said that we should never doubt that a small group of thoughtful, committed citizens can change the world. I have seen it. I have seen it happen, and I am seeing it now. Thank you.
Thank you. Give me a hug, please. Thank you.
Let's hope there'll come a day when we don't need a rally or a meeting, that we've conquered this. I'd like to thank Laurie and Dorothy for speaking from their hearts. You could hear the loss in their voice. Would any of the other elected officials like to say anything at this time? Michael?
Thank you, Supervisor. Thank you, Supervisor, and thank you, everybody, for being here today. I've had the very sad, unfortunate experience of seeing this in my own family, losing two loving, beautiful, wonderful nephews. As a first responder, I see it all too often. As the district attorney mentioned, there are new drugs that are coming out, Trank, xylazine. This is something that is as potent, if not more potent, than fentanyl. It's coming this way. It's an animal tranquilizer that they're using to cut heroin and other drugs. Every day is something new. But something that's also very important, and Laura, you alluded to this a minute ago, is that, and as a first responder, we bring folks, most of them we're able to save, thank God, but when we bring someone to a hospital, the hospitals kick them out as quickly as we get them in there. Why? Because the insurance companies won't pay the tab to help them. So what we need to do is, in addition to working with our New York State elected officials to bring in bail for these criminals who are selling these drugs, but also we need to work with them so that they legislate and require insurance companies to pay for treatment. Not only pay for the emergency room visit when we bring them in, but pay for the treatment, get them better, because they kick them out, and then what happens is they're right back in. We've had situations where we get the same person 2 times a day. We save them, we bring them in, and then the hospitals kick them, and they're back out on the street again, and then we bring them in that night. That can't happen. They have to put them in a program, and the insurance companies have to be required to pay for it. So please, speak to your New York State Assembly and senators and get them to legislate requirements for the insurance companies to treat these people with the treatment that they need. Thank you. God bless you.
Thank you. Thank you very much. I want to thank you all. You want to say a few words? Okay. Jonathan?
Thank you. So I want to first extend my sympathies to the families of victims that are here, and I wish you peace in your suffering. And in addition to that peace, I hope you will find continued strength to keep up this fight. I appreciate your comments, Dan, of putting a human face on this and a reminder that our fight is not against addicts, but it's against addiction. And I want to recognize on a hopeful note, I want to just amplify the and build on what District Attorney Tierney said about the need for action. And I want to talk about a small group of thoughtful and committed citizens who are working on this currently right now. I want to recognize Michelle Schindler and Sal Pitti, who are the co-chairs of the Council District 1 Drug Prevention Coalition. This is an effort that was started by Valerie Kornreich, and I was one of the, I was actually on the school board at that time, and I was one of the original members. This is probably 8 years ago. And I never thought that I'd be standing here today keeping that work alive. But this is a model, this is a hyper-local model of deep engagement through community organizations, through local businesses, through the Chamber of Commerce, through civic associations, and working closely with the school district, doing all kinds of activities in the school, outside the schools, to raise awareness, to reduce the stigma, and they're having an impact. These are very, very fine people who are working very, very hard today and have produced a model that can be replicated all over the town. I know that this is something the supervisor and I have spoken about. This is something that he wants to see this model scaled out and extended and articulated out all across the town of Brookhaven. I know that he's been working on it, so thank you, Supervisor, for that.
Thank you.
Thank you very much.
Thank you, Jonathan. We end with a mission of hope, a mission to lobby our legislators so insurance companies cover treatment, a mission to encourage greater treatment facilities, a mission to treat those that are addicted with kindness, a mission to work with our district attorney to lobby our state legislators to make sure that the dealers of drugs that deal death face the penalty of law and not a revolving door of justice. Justice should be, and there should be penalties for those who would spread these deadly drugs among us and seek to kill us. We've lost more than one person a day in this county. This has to end. Working together, working as a community, as Jonathan spoke. We can do this. This is a nation of doers. This is a time for us to stand together and demand action. It isn't going to come easy. I know the legislature came up with cashless bail. It doesn't work for drug dealers. It doesn't. I know the legislature hasn't acted on insurance, state legislature. But I know one thing. If we stay with it, if we commit ourselves to this, we can accomplish that. And then we've got to work to expand our treatment facilities, to make sure that there's places for people that have addictions to go to cure themselves and clean themselves. And we have to show the kindness to those people. I see the pictures. I can only imagine the heartache. Let's take our pain and channel it into action. So today we start, and I know all my council people behind me, all the elected officials of this town, will stand with you. Let's make the difference that we need to make. Let's build a better community, a safer community, where we don't have to hold up pictures of children that we watched raised and we've lost. God bless you all for coming. Let's carry on the fight. Let's stand together in this. Thank you so much.